Have you ever heard of Breztri Inhaler? If you or someone you know is dealing with chronic obstructive pulmonary disease or COPD or has been struggling with asthma, this medication might come up in conversations with your healthcare provider. Breztri Inhaler is a prescription inhaler designed to help manage these conditions by improving breathing and reducing inflammation. Today, we'll dive into 10 important facts about Breztri Inhaler to help you understand how it works and why it might be prescribed to you. Number 1. What is Breztri Inhaler? Breztri Inhaler is a specialized inhaler used primarily for managing chronic obstructive pulmonary disease or COPD. It combines two powerful ingredients, budesonide and formoterol. Budesonide is a corticosteroid that helps reduce inflammation in your airways, while formoterol is a long-acting beta agonist that relaxes the muscles around the airways, making it easier to breathe. Together, these ingredients work to keep your airways open and reduce symptoms like wheezing and shortness of breath. While it's a game changer for many people with COPD, it's important to note that Breztri Inhaler isn't typically used for asthma. The medication hasn't been approved for treating asthma due to specific concerns about its effectiveness and safety for this condition. If you have asthma, there are other treatments that might be better suited to your needs. Number 2. How does Breztri Inhaler work? Ever wondered how an inhaler can make such a difference? Breztri Inhaler works through a combination of its active ingredients. Budesonide, the corticosteroid, works by reducing inflammation and swelling in the airways, which can help prevent flare-ups and make it easier for you to breathe. On the other hand, formoterol is a long-acting beta agonist that helps relax the muscles around your airways, providing relief from constriction and making breathing smoother. This combination allows for more effective management of COPD symptoms, helping patients breathe easier throughout the day. It's like having a two-pronged approach to respiratory care, one to tackle inflammation and the other to keep the airways open. This dual action is why Breztri Inhaler can be so effective for people with chronic breathing issues. Number 3. Who should use Breztri Inhaler? Breztri Inhaler is primarily prescribed for people with COPD who need long-term management of their symptoms. It's not typically recommended for people with asthma, as the medication hasn't been proven safe or effective for this condition. So if you have COPD, your doctor might suggest Breztri Inhaler as part of your treatment plan to help manage your symptoms and improve your quality of life. Before starting any new medication, it's essential to discuss your health history with your doctor. They'll consider factors like your specific condition, other medications you're taking, and any potential allergies. This personalized approach ensures that Breztri Inhaler is the right choice for you and that your treatment plan is tailored to your needs. Number 4. Precautions and warnings. Before using Breztri Inhaler, there are several important precautions to keep in mind. If you've had a history of allergic reactions to similar medications, or if you have certain medical conditions like tuberculosis or severe infections, it's crucial to discuss these with your doctor. Breztri Inhaler contains corticosteroids, which can impact your immune system, so it's important to address any potential risks with your healthcare provider. Other considerations include monitoring for high blood pressure, weakened bones, and eye problems, which can be side effects of long-term use. Your doctor will guide you on the necessary precautions and help you manage any risks associated with this medication to ensure it's safe and effective for you. Number 5. Possible side effects. Like any medication, Breztri Inhaler can have side effects. Common ones include throat irritation, hoarseness, and cough. These are usually mild and can often be managed with some adjustments. However, there are also more serious side effects to watch for, such as adrenaline insufficiency, high blood pressure, and bone density loss. If you notice any severe or unusual symptoms, it's essential to contact your healthcare provider right away. They can help determine if these symptoms are related to the medications and whether any adjustments need to be made to your treatment plan. Keeping an open line of communication with your doctor helps ensure that any potential issues are addressed promptly. We made a book, 10 questions everyone should ask their pharmacist. You can find a link in the description below. Feel free to check it out. Number 6. Proper use of Breztri Inhaler. Using Breztri Inhaler correctly is key to getting the most benefit from the medication. Be sure to follow your doctor's instructions on how to use the inhaler, including the number of puffs and how often to use it. Proper inhalation technique is also important to ensure the medication reaches your lungs effectively. One tip is to practice your inhalation technique with your healthcare provider or pharmacist. They can show you the correct way to use the inhaler and answer any questions you might have. Consistent and correct use of the inhaler helps manage your symptoms effectively and prevents unnecessary complications. Number 7. What to do in case of overdose. If you accidentally use more of Breztri than prescribed, it's important to know what symptoms to look out for. Overdose symptoms can include nausea, dizziness, chest pain, and an increased heart rate. These symptoms require prompt attention to avoid more serious complications. If you suspect an overdose, contact your doctor immediately. For severe symptoms, you should call emergency services or go to the nearest emergency room. It's better to err on the side of caution when it comes to medication overdoses, as timely intervention can make a significant difference. Number 8. Storage and handling. Proper storage of Breztri is crucial to maintaining its effectiveness. Keep the inhaler at room temperature, away from heat and moisture, and avoid storing it in damp areas like bathrooms. If you have multiple inhalers or a new one, make sure to follow the storage instructions on the packaging. When it comes to disposal, it's important to do so safely. Check with your pharmacist or local disposal center for guidelines on how to dispose of unused or expired inhalers. Number 9. Impact on daily life. For many people with COPD, Breztri can significantly improve their quality of life. By reducing symptoms like shortness of breath and wheezing, it allows for easier breathing and better management of daily activities. This can make a big difference in your overall well-being and ability to enjoy life. However, it's important to adapt your lifestyle as needed while using Breztri. Regular checkups and monitoring are part of managing your condition effectively. Your healthcare provider can help you with any lifestyle adjustments needed to optimize your treatment and maintain your health. Number 10. Consulting with your healthcare provider. Regular consultations with your healthcare provider are essential when using Breztri. They can monitor your progress, address any side effects, and make adjustments to your treatment plan as necessary. Open communication with your doctor ensures that you're getting the best care possible and that any concerns are promptly addressed. If you have any questions or uncertainties about Breztri, don't hesitate to reach out to your healthcare provider. They are your best resource for personalized advice and support, helping you manage your respiratory condition effectively and safely. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications. And cheers to a healthy life.